Good morning. I'm Amy Smallers, Senior Director of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association. And on behalf of MHA, welcome to today's Executive Insight Series session. We're thrilled to be continuing this series, which has hosted nearly a dozen interviews with healthcare leaders on the most important topics facing our Commonwealth patients and caregivers. A few logistics before we start. We will be recording this session for those who aren't able to join us, and all lines are in listen-only mode. If you have questions during the webinar, please enter them into the chat, and we will do our best to get to them during our time together today. Following the webinar, we will be sending out the recording. I want to take a moment to thank MHA's 2025 annual sponsors, as well as our strategic partners, for their support in underwriting MHA's programs. It's now my pleasure to hand it over to Steve Walsh, President and CEO of MHA.
Thank you, Amy, and thank you to all of our guests once again for joining us. A big welcome. We really appreciate you making this such a great success. We're really proud to be in our fourth year of this Executive Insight Series. We get to sit down and pick the brains of some extraordinary people and leaders in our Commonwealth and beyond over a morning cup of coffee. We started this during COVID as a way to continue to connect with our members and our audience and our leaders, but it has worked so well because it's just a great opportunity for you to be able to get to know some of the folks that lead our systems really without having to leave your car or your office. And we've certainly had some great conversations. But behind our world-class system are really world-class leaders. And behind those leaders is a unique story, a distinct view in the future of our care delivery, and an unwavering commitment to patients, workers, and the communities that they serve. And that's certainly true of today's guest, John Fernandez. John has served as President and CEO of Brown University Health, then known as Lifespan, since early 2023. Brown University Health is a comprehensive academic health system that employs more than 20,000 people and cares for more than 550,000 people across Rhode Island and southeastern Massachusetts each year. As many of you know, John has a long history of healthcare leadership here in Massachusetts. Prior to joining Brown, he was president of Mass Eye and Ear, one of the nation's largest specialty hospitals. He also served as president of Mass General Brigham Integrated Care, which was formed in 2019 to bring lower cost care closer to patients' homes. During that time, he became an important voice within our MHA network and our broader Massachusetts healthcare community. And now he's back as Brown University Health took over St. Anne's Hospital in Fall River and Morton Hospital in Taunton last October. John, we're grateful to have you as part of our network yet again, and thanks for being with us this morning. So to dive right in, I want to hit the rewind button. Take us back to the beginning. What originally drew you into healthcare and eventually healthcare leadership here in Massachusetts?
Well, Steve, thanks for having me. Great to, I don't really feel like I came back. Rhode Island, remember, is not that far away. But great to be back and great to be on your show. Actually, I moved to Boston in 1987, so I came to Boston before I got into healthcare. But what got me into healthcare was I was raised in a family. My dad's a minister, my mom was a teacher, and then some of you know she was then became a politician. So by their actions, they encouraged us, or the three boys, to do some good in their work. And so healthcare is my way of doing some good.
John, I didn't know the answer to the question. Often we don't know what the answer is going to be. And I feel like there's going to be chapter 2 of this discussion because my dad was a priest before he left and got married. And my mother was a politician and the matriarch that got me into politics. So we have more to talk about. And that might be an evening conversation, I think. But, none of us.
The priest one will probably be more interesting.
What's that?
The priest one will probably be more interesting.
None of us get here without really strong mentors, right? I mean, that's what eventually helps us choose a path, get to our place. Did you have an especially important mentor or turning point for you along your career?
Steve, I'd say I go back. I was lucky to have great parents, but I've had lots and lots of mentors, and I thought about starting to list them. And then I said, if I do that, I'm going to probably insult several people that might even be on this Zoom. But I did want to call out a friend, colleague, mentor who really gave me my first shot when I was in my late 20s at a big management job, and his name was Mike Zinner. and he was the chief of surgery at the Brigham, and took a risk on me in my late 20s to in a leadership role. So he probably stands out. But there have been so many. And the other thing I would say is that I've learned a lot from the people that I've worked with and for, just by watching them, what they do, what they say, how they act. So it's been a blessing to be in the Boston market for such a long time and learn from so many people.
Yeah, and now you've the last few years turned your attention to the Rhode Island market, right? And it's
Yep.
a little different. As you said, it's very close, but in some ways very far away. In the way we all do things differently. As we say, if you've been to one hospital, you've been to one hospital. So how does it compare to your previous work in Massachusetts? Any big similarities, any major differences?
You know, a lot of similarities in that we have the two hospitals in Massachusetts, St. Anne's and Morton, has been terrific. But I'd say the big difference is we're paid a lot less in Rhode Island, whether it's Medicare, Medicaid, commercial pay. We're about 20 to 25% less. The other difference is there's fewer hospitals, but there's no public hospital. So like Rhode Island Hospital serves as both our sort of uh, public hospital and our private hospital at the same time. So a little different than other markets, and something I've noticed here.
Yeah, you know, we and we don't think we're paid enough here, right? We haven't had many CEOs come in and say, I'm overpaid by my reimbursement rate for the things that we do for our communities. And certainly a big struggle now. You know, we've had a bit of a parochial feel in Massachusetts. We do a lot of things really well. It's a world-class system. But takeaways that we can learn from our neighbors to the south here?
I'm not sure there's a learn from. It might be how to copy it. There's a real cooperative spirit in sort of the business, civic community, and we've come together around Medicare, Medicaid rates. So I think how we get with people are not just in healthcare, but other businesses, community leaders, and that sort of cooperative spirit has been that may be enhanced by the size of Rhode Island, but I would say it's something that we could do a little better in Massachusetts. How can we zero in on one or two things, because there's so many things to fix? How we come around one or two and get our communities to help support us.
Yeah, I've been really impressed your leadership and some of your colleagues in really taking this Medicaid fight on in Rhode Island in somewhat of a public way, just saying we are underpaid for the care that we deliver to our patients. It's been really fun to watch, and I do think there's something we can learn from that. You know, it's well documented now. I mean, we spent a lot of time talking about Stewart Healthcare and kind of the challenges that created for our communities, north and south. And your organization stepped in. There were two essential hospitals in southeastern Massachusetts. I know that wasn't without conversation, challenges, you know, complementary relationships and conflict, but it's hard work to take over and stabilize those facilities. How's it been going so far?
So Steve, I'd say it's been going very well. The teams at St. Anne's and Morton have been terrific, but there's just a lot of hard work changing our medical records, our financial system. So just a lot of just basic hard work. We're probably in if it's a baseball analogy, one of my favorite sports, and the Red Sox might be winning a game or two. We're probably really still in the first inning, maybe the second, but it's a long journey, and look forward to the future.
Anything so far that's jumped out at you or surprised you about it?
I would say probably the biggest and most pleasant surprise. I guess I shouldn't have been surprised, but the eagerness and the enthusiasm and the welcoming of the St. Anne's and Morton hospitals, doctors, nurses, staff, you know, how grateful they were, and the joy, absolute joy to work with to turn things around there. So their commitment's just been beyond the beyond from my point of view. Yeah,
and in the early season for the Red Sox, anything surprising you there, good or bad so far as we watch these first few games?
It's a long 160 games. It's a long season. I would make no predictions.
I like our new second baseman, though. We'll see what happens
Yeah.
with him. So what do the next few months look like on the southeastern border, and what's next in terms of continuing the process to integrate those hospitals?
Yeah, the first big step is to, by the end of the summer, we should have all our new systems in place, Epic and Workday at our new hospitals. That'll be a big step forward. Because right now we're still working under the transition services agreements, which are using the old system. So that'll be the first big step. And then literally just hiring the doctors and nurses and staff to continue to care for the patients in those communities. The volume's been relentless, as I know my colleagues around the state of Massachusetts and Rhode Island. So just a lot to do to uh, improve the care and continue to take, our job is to take care of patients. So, and there are plenty of them.
Yeah, and plenty of patients, and sometimes not enough workers. And you've been a leader in our workforce discussions here. How's that going? Are you finding people coming back to the vocation? Is the pipeline strong?
Oh, it's positive. It's better. Our retention rate is better. Our recruitment is better, but I can remember days when we didn't have turnover in the teens, and we need to get back to that, but it's still a huge problem. Doctors, nurses, techs, still in demand. So, don't want to recruit from my colleagues here, but anybody looking for a job in Southeastern Mass or Rhode Island, we have opportunities.
Yeah, and I think everybody's in the same boat, right? We've got to grow the pie, train and attract people from other industries. And in the middle of all this delivery of care, you've been undertaking a major rebrand, right? So Lifespan became Brown University Health. What does that change represent, and why has that been important for the organization?
So I look at the rebrand as it's also a new beginning for us, a real positive change for the organization. Um, just to be clear, it's Brown University Health, but we're not owned by Brown University, two separate independent entities. But it's given us a chance to sort of reintroduce ourselves to our community. But one of the biggest things we've noticed even early on is our ability to recruit regionally and nationally. The name recognition really does make a difference.
Yeah, you've been through brand changes before. They're not easy, right? I mean, it's
No.
a hard process. Is that the future? Or are we going to be thinking a lot about brand and how we attract in such a consolidated market?
I think brand's part of it, but it's also providing great service. It's thinking about the future and looking around the corner. So I think brand is just a piece of the puzzle. For us, I think it was we needed to turn some things around, and this name change sort of helps on that culture build.
Yeah, we're all so good at what we do in terms of providing care, and one of the things that worries me is continuing to provide that highest level of care with the challenges that you're all facing, right? I mean, it must keep you up, forgetting about the politics of the day, simply the idea that you have to fulfill mission in what's a really challenging time when the money is really tight. Now, getting stuff done is like a personal motto for you, right? We all have, the bear was every second counts, and Ted Lasso was believe, and yours is getting stuff done. It's a personal motto for the Brown University Health leadership team. How did you start that, and what does it kind of say about how you're thinking within the organization?
It started back when I was, I think, sort of towards the end of Mass Ioneers as an independent organization when it joined partners. So when I entered MGB, I kept thinking about how to get stuff done, so-called GSD, different S for those of you with potty mouths. Um, so that's when it started. I just brought it with me to Rhode Island, and have had a lot of fun with it. My senior management group, instead of calling it senior management, we call it GSD. So I think it helps us send a little message about getting stuff done and taking care of patients is really what we're all about.
Great. You've often spoken about beyond the getting it done, the wow moments for people that seek care. Eddie, the one thing I often say that we all have in common is we've all been a patient or the loved one of a patient. Um, it's a goal shared by so many of us in healthcare. How do we look for opportunities to create those wow moments for our patients?
Yeah, it's very, it's very difficult, but I think it's being intentional and really working hard and making that a high priority. So that wow care. It was interesting. We were talking a lot when I first got here. What do we call that? And one of my colleagues says, "Why don't we just stick with wow?" And the fun part has been people trying to figure out what that acronym is. It's not an acronym. It's something we want to do. So when a patient leaves, they say, "What great service!" Every one of them, whether it's a clinic, the ER, we got a long, long way to go in our organization, and I know it's a journey, and we just got to get on it and day by day make improvements. I think
Yeah.
the other key part of that is um, kindness, and I think we need to continue to hire for kindness. Think about how we do that each and every day. And that's not being nice, it's being kind. They're two different things. You can look it up on your chat GBT.
Yeah, it's a great point, and it's kindness is free, but the jobs are so complicated and difficult now, and the pressures are so real. Creating that culture of kindness is probably one of the most important things that we can all strive for, right? It's retail. What we do beyond just the saving lives is the retail component of this and providing kind care and service to our patients. Now you're on the journey and there are speed bumps. Um, what's what's standing in the way for your system in making these type of wow moments, this culture of kindness, this new care experience possible?
So I was thinking about that. I'd say there are three. One is just time. It just takes time to make the changes necessary. So if there's any way we can speed that up, we ought to do that collectively and individually. Second, I would say regulation is in our way. We've overdone it. I know it's true in Massachusetts, but in Rhode Island it's worse actually. If you can imagine that, I didn't think I'd find worse than Massachusetts, but I have. There's just too many rules that are layered on top of layers. We got to get rid of some of them. They're just not useful anymore. And then I think maybe the biggest is our ability to make the changes we need is us, the people in the organization, just saying, it's a different time and place, and we need to make those changes ourselves. And it's not somebody else, and that's hard inside large organizations to look in the mirror and go that we need to do some of this. How we answer the phone, how we allow for online scheduling, how we use technology to help us, not get in our way. We've got a lot of work to do there.
Yeah, I love that you said that. We often get criticized for something I think is very true, is we're very rigid in healthcare and somewhat slow to change. And that's the type of innovation that it's exciting to hear you talking about. And folks can feel free to throw questions in the chat as we kind of come up on our question point. And I got one. I'll ask it in a more general way. One of the challenges of our new operators taking over existing facilities was delayed maintenance and facilities. Have you been thinking about your campuses and how you catch up with some of what was deferred, delayed, or just undone maintenance to the facilities you took over?
Yeah, actually, we have a shared experience in Rhode Island. When we picked up St. Anne's and Morton, there's definitely some deferred maintenance, but good news, bad news is we have experience because we have a lot of deferred maintenance in Rhode Island, probably 1.2-ish billion dollars, because we hadn't met our margin targets for a long time and therefore did not invest in our plant. That was, I would say, St. Anne's and Morton, two of the cleanest. Uh, I'll give a shout out to South Shore, maybe not South Shore level, but two of the cleanest hospitals. When you walk around, the floors are clean, spotless, but some of the infrastructure, whether it be an elevator or old buildings or old air handlers, stuff like that, that we do have to fix. So, but the key to that is making a margin, and we're focused on making that margin so we can invest in those places. I can tell you, I was at an event at Morton the other night, and the fact that we were spending some capital at Morton Hospital and at St. Anne's was very appreciated, because they'd had years of literally almost zero capital, which is that's pretty hard to, with no new equipment, et cetera. So we, at the two Massachusetts hospitals, we have a ways to go, but unfortunately, we have experience with that in Rhode Island as well.
Yeah, and that's one of the hardest things to do is raise capital, right? I mean, it's not, it's not reimbursable. I mean, it's very, very difficult and very necessary. I think that front door curb appeal is often overlooked. I know when I visit a hospital anywhere, and as I travel, I try to visit a big hospital in other cities I go to, I just walk around, right? And you learn a lot just walking through that front door and looking at it and striving to have that environment that is really welcoming to people and less clinical than it has been. That's part of the retail that we haven't done historically. Is that something you're trying to put into your facilities?
Yes, some of our facilities, actually, I would say at Morton and St. Anne's, the ERs are pretty up to date. I have a little room for improvement, but we're doing some renovations here in Rhode Island, both at Miriam Hospital and at Rhode Island Hospital, to make the front. We just had a new lobby. It started before my time, but new lobby at Rhode Island Hospital makes a big difference. That first impression is important, and also making the services easy to access is also something we have a lot of work to do, particularly at the bigger hospitals.
And we got just a question about integration. How has it been to integrate the systems together onto Epic or whatever form you're using with your other facilities?
So 2 points there. I would say it's going pretty well with Epic, and we're doing Workday system wide. So that was sort of an add-on. We just added 2 places on because we don't have Workday today at our Rhode Island hospitals. It has been, and I'm sure my BMC colleagues and Merrimack Valley colleagues might say the same thing, but it's been a very, very bumpy road. People might think Stewart is gone, they're not, or they weren't. And so the transition from their computer systems of what's called the Transition Services Agreement has been less than ideal, would be the politest way to put it.
Yeah.
Because we'd have to deal with, we still had to deal with them on those services, but could have been a lot better.
I'll go back to the and then we'll get back to your career, but public policy point you made a few minutes ago, when we've looked around the country, kind of post COVID, as us recovering less fast than other areas, it's overregulation is the one thing that seems to be the indicator of the states that are having more difficulty catching up. And it may be counterintuitive, but we really do have a regulatory environment that doesn't allow us to care as efficiently for our patients as we might want.
I could not agree more. I mean, you think of what we're doing with pre-auth, what we're not doing, does DON or CON in Rhode Island. I mean, it's just a complete waste of time and money, and we have to wake up to a new world pretty soon, because it's costing us too much. And I know people love the regulations, but it doesn't make sense anymore.
Yeah. This question, I got one answer. I don't think this is the answer you'll give me, but I asked a leader once what their hobby was, and they said work. So I wonder, do you have a hobby outside of work that keeps your mind clear and keeps you busy?
Oh, that's pretty easy. If there's a sport, I'll play it. I had to retire from basketball last May, but whether it's golf or a racket sport or you name it, I'd like to play it. So that's what I do to hike. All that activity stuff is what I do to keep myself sane.
And how about are you a TV? Are you a Netflix guy? What's your favorite movie?
So for all of you on the phone, the cheat was he gave me a heads up on this one. So but the one I would say my favorite movie or series of all times was The Godfather. Great management tool in that movie, but you'll have to look past the killings. And then my favorite Netflix series so far, still the jury's still out, but Ozark so far is the winning.
Ozark is tremendous, but there is a theme there too. We
It's
try
a
not to
little
use
dark.
violence anymore for our management tool, but yeah, those two might show otherwise. And you're sharing a meal with a notable person, dead or alive. Who's your guest at the table?
Michael Jordan.
Okay, yeah, the
I
last
tried to I tried to keep that a little light. When I went dark on the movies, I thought I'd keep it light at dinner.
Yeah, I'm still taking Larry Bird, but Michael is the greatest of all time. You know, we get a lot of emerging leaders on the call, and we always like to ask this question: is there a great piece of advice you've gotten along your journey that you'd share with others?
I'd say there's three quick ones. One is that I got pretty early in my career by another senior person that said, leave time in your schedule to think, but don't make that Friday afternoons at 4. Find time during the week to leave some brain time. Second, I'd say is I would encourage people coming up through the ranks to be bold, have an opinion, but listen. Um, I think there's too many people that either don't listen or don't speak up and have an idea and an opinion on their own without just waiting to see what others say. And then I couldn't resist, but I'd say be kind. It's more than nice. So if we can be kind to each other and our patients, or kinder, maybe is the right word to say, would be what I'd encourage people to do.
Yeah, I love that. I love all three. Kindness is an obvious one, and I think you got a lot of folks Googling the difference between nice and kind this morning. It is important, I think, for our young leaders to have a voice, know their agency, but be able to listen. I want to go back to your first one, because I think we all struggle with it. Sometimes now, I think with Zoom, the convenience of it, our schedule gets more full, not less, right? And you don't have, I used to say we had to build in a virtual commute, walk two times around the building before your next meeting. Do you find that it's more difficult to get that thinking time when you can be pulled now by text, by phone, by Zoom, and then in in-person meetings?
No, I've actually found that technology, especially, cell phone, yes, you can be reached all the time, but it also gives you some flexibility to not be wedded to a particular location. So I think the real issue with time is for the thinking time is you have to almost, I actually put it in my schedule. Because if you don't lock it down, it'll go away with a Zoom, a call, 15 texts. I think that's the important part of the intentionality of making that time. Because I think you're right that you can definitely do more meetings with Teams and Zoom. It's not always a good thing.
Yeah, and the profound relationships we built through the COVID time by being so connected to each other through text or cell phones or other things. Now it's almost like you're always on, right? So you really got to schedule that piece. Well, it's been a great conversation. We could go on all morning. Certainly, we are all rooting for your success, for the communities that you are now serving, the communities you have served, and the patients that live and work in those areas. And I know you've got some great colleagues that are surrounding you there on both sides of the border, that are ready, willing, and able to help with anything that you need. Any last words you want to share with our team before we let them go back to their day?
Just a big thank you to you, Steve. You and the leadership in the state and many colleagues around the state. It's been nice to be. I know I didn't leave for long, but the welcome back and the help during the steward part was really, really a big deal. People downplay it, but it was a really difficult time, and people pulled together, and I really do appreciate the support along the way.
Well, thanks for saying that, and we agree. And I think that one of your threads this morning is going to be even more important as we get to even more difficult times with a finite pie, and the ability for us to be open, accessible, welcoming, and kind to each other will make all the difference. So thanks for joining us. This brings us to the end of our morning cup of coffee here together. John, thanks for spending a little time today for the tremendous work that you and your team are doing to usher in a new age of healthcare for your patients and workers, and an important chapter for those that have been working, living, and getting their care in Morton and St. Anne's hospitals. We're proud to be your partners and to continue to learn from you and your team along the way. To our attendees, thank you as always for being part of our Massachusetts healthcare community. Every conversation like this brings us a little closer together, and our unity will be more important than ever in the months and years ahead. And if you enjoyed today's discussion, we've got a dozen of other events lined up this year that we've created with you in mind. Our annual Emerging Leaders Summit is coming up on May 1st, and you can visit mhalink.org to check out the full listing of opportunities. Thanks so much for joining us this morning, and have a great day.